The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to Meet the Doctor. My guest today is Dr. Joe Gryskiewicz, and I actually do know how to say his name, but most people don't. And he's a plastic surgeon, longtime plastic surgeon in the Twin Cities in Minnesota, which is, of course, where I'm from. Welcome to the podcast, Dr. Joe.
Thanks. Yeah, I'm Dr. Joe Gryskiewicz, and they usually call me Dr. Joe or Dr. G.
And I did say it wrong.
And I'm a board-certified plastic surgeon. Well, you say it like my mother said it, so it's okay.
The Polish way?
Yeah.
But then there's the other Dr. Joe Gryskiewicz, and I said his right because I was going to...
That's how he says his name.
It is, yeah, and I was going to say, do people still mix you up with the other Dr. Joe Gryskiewicz?
Oh, yeah. When I go to the meetings and I'll get a registration form, it'll be his hotel room. And it's like, no, I'm not staying in this hotel room. And and I know that all Polish names look alike, but actually there's two letters different in our names.
Completely different.
Yeah, right.
Yeah.
Yeah, he says Gryskiewicz, I say Gryskiewicz, but yeah. But It's actually Gryskiewicz in Polish, so whatever.
That's a lot of consonant clusters. Yeah. Fun fact, I took Polish in grad school for fun.
Really?
Yeah.
Holy smokes.
Yeah, after I took Norwegian in college, then I went to grad school and took Polish, which has all turned out to be incredibly useful.
Wow. And St. Olaf, yeah, Norwegian, I could see that.
Yeah,
right.
When you're a Norwegian kid in Minnesota, you get shipped off to Norwegian camp. I don't know if they had Polish camp, though. They might have.
Not that I know of, but I'll tell you, St. Olaf is a really good school.
Mm-hmm.
If I had to pick one college where most of the people in my med school class came from, it was St. Olaf.
Really?
Yeah, they were a pipeline to med school.
And did you go to med school at the University of Minnesota?
Yes.
Oh. Were you originally from Minnesota?
Yes. Little town called St. Paul.
Oh, yes. That other town. So have you ever really lived anywhere else but the Twin Cities?
Well, I did my training at the University of Wisconsin, so I lived in Madison for 7 years.
Okay.
And since my grandpa and grandma were from there and I'd spend summers with them, I've probably been in Wisconsin for 8 years of my life. I've been in South America for a good year of my life, and then just the Twin Cities.
Where were your grandparents in Wisconsin?
Right in Madison.
Okay. Mine were in Sheboygan.
Oh, yeah. Getting up there.
Yeah. Brats and beer.
Yeah.
And more brats.
And curd. Don't forget
cheese
curds. Right.
That's right. Yeah. So this isn't the usual conversation that I have on this podcast, but it's fun. So you've been in practice for a while. Tell us how you got started and where were you in the beginning?
Oh, yeah. I started 38 years ago. And, I started in a little suburb of Minneapolis called Edina. Every day I need attention. And did a lot of reconstructive work and then gradually transitioned into cosmetic. And what got me into plastic surgery was I went on a mission trip down to Guatemala and saw all these kids with cleft lips and cleft palates. And I thought, I really want to fix those. I want to do something for them. So that's what pushed me towards plastic surgery because it's so artistic. And so I've been going on mission trips since 1984, which was my senior year in residency. And then every year after that, when I was in practice, to do the cleft lip and palate things.
Every year since then?
Yeah, except until COVID, and that caved it all in.
And are you ever planning to go back again?
Sure, but so far it hasn't recovered.
Oh, no.
Yeah, I mean, they're not. The hospital pretty much is not letting anybody back in right now.
In Guatemala?
Well, the hospital we're going to now is in Peru, and we went to Lima and a little town in the mountains big town in the mountains called Arequipa. And how you want to look at it.
So at what time of year do you usually go on that trip?
January.
Yeah, that's a good time to leave Minnesota.
Yeah, good time to leave Minnesota, right.
And it's nice down there at that time?
Yeah, it's not. It depends where you are. I mean, in the mountains, it's cold. And in Lima, it's really hot because you're at sea level in Lima and you're higher altitude in the mountains.
Who goes on that trip with you?
Well, a whole bunch of doctors, anesthesiologists, nurses, surgeons from around the Twin Cities.
Is it organized through
There's
like a nonprofit?
There's a lot of foundations that we've gone down with, but the current one for the last maybe 12 years that we've worked with is San Francisco de Assis, so St. Francis of Assisi, so to speak.
Ah, got it.
Yeah, so they're organized.
So that's probably a nice counterbalance to Edina housewives.
That's right. Suck fat in Edina and help kids with cleft lips in South America.
Okay, we're being a little bit Minnesotan with our humor here, which sometimes doesn't go over very well with non-Minnesotans. And I actually kind of learned that the hard way, that I would be a little bit like straight-faced and say something a little sarcastic, and it just would go over like a lead balloon. But feeling very comfortable with you here. So in 38 years, you've seen a lot of things change. And before we get to what's changed, kind of tell me about what your focus has been. Are you mostly body, mostly face? And what have you been passionate about procedure-wise over the years?
Well, I think the hardest surgery in plastic surgery, and as far as I know, everybody agrees, is rhinoplasty, and that's my passion.
Definitely. What about revision+rhinoplasty?
Yeah, a third of my patients are revisions from somewhere else. So if I do 100 rhinoplasties, 33 of them are secondaries or tertiaries or worse. And then second would be breast augmentation. I do more breast augmentations than anybody in Minnesota, 3 times more than the second highest person. So that's probably the 2 main things. But, people come in, they want mommy makeovers and, they want implants, but there's a lot of other stuff they want too, to kind of go back to BC, before children, that kind of thing.
Mm-hmm. How big is the team around you?
We have 14 employees in the office.
How many other providers?
I'm the only provider.
Oh, it's just you. So is there a med spa component, or just...
So we've got people doing the lasers and the cool sculpting and all the facial skin treatments and so on. And then we got a big crew, and we've got people that help me in the operating room. And we got a real nice team. It's a real warm, friendly family atmosphere.
When you kind of look back on the experiences you've had being in the same place, like in the beginning, it was all surgery. There was no non-surgical. So when you started, what kinds of people were coming to you, and what was different about them then maybe than how they are now?
Oh, the expectations are much higher now, especially in the last decade. People come in and have seen things on the web, and they want that, which I think really helps. I mean, I want everybody to give me their wish pictures. I'm trying to read their mind. So I want them to show me, I want cleavage. Okay, what does that mean to you? And let's look at some pictures and let's see if I can deliver or not. So I think it's been really helpful. And you can tell, actually, when patients come in and they haven't done any research, it's actually a little more tedious to do the consult.
It is.
Because you just start right at square one, whereas I'd much rather have a sophisticated, well-educated patient who knows what they want right off the bat.
Before social media, how did they do wish pics?
Oh, they didn't. In fact, it was frowned upon. I mean, the teaching back then was if you bring in a picture of a nose that you want, the surgeon really should decline to do the surgery. It's just not, it's unrealistic and it's not going to fly. And it's like, yeah, I kind of get that. I mean, you get people bringing a picture and it's like...
Only if the picture's unrealistic.
Exactly. Right. But that was the teaching. And I remember one morning my partner came to me back then and he said, boy, this lady brought in a picture this morning. I'm supposed to do her nose job in like 30 minutes and I'm really feeling uncomfortable because I can't do this. And, we're not supposed to do pictures. And I said, cancel her. See, now I would have said, well, let's talk to her about what you can and can't do in the picture.
Yeah.
So that was bad advice, but that's what we all did back then. Mm-hmm. So it's really changed, and for the better, I think.
I just heard a story about a surgeon who I know who's 92.
Really?
Yeah. not working anymore, obviously. Retired a while ago, like 15 years ago. But we were talking about how did we do rhinoplasty consults before we had iPads and computers and visualization software.
Imaging systems, right.
And what he did, I found this so fascinating because it spoke so highly of how he thought about patients, was he would actually shoot their photos, their before photos at their consult, and then bring them back 2 weeks later after having gone to the dark room, developed all the photos, and then he would draw on the photos and show them what he was going to do.
Yeah.
And so their consults were 2 sessions, 2 weeks apart so that he could show instead of just tell. That was Merle Olison, who you may have known at some point in your career. And they told me that people always moved forward because they understood what was going to happen.
Yeah, I've done the same. We do life-size photographs and I draw on them. That was way back when,
And now what tools do you use now?
Now we use an imaging system by TouchMD and draw on them. And then they can look in their web account, and show their significant other or somebody, their next door neighbor, whatever.
I like to look at mine in there because I can see how much better my face looks over time. It's one of my favorite things about TouchMD. I can go, look how bad my skin used to be. I can show anybody I want how much better it is. It's
good.
It's pretty powerful.
Good.
Yeah, I love them. So you use TouchMD. Do you use any morphing software, or is that sort of not how you think about it?
No, I draw with the TouchMD and really get down to what they want. And you can add or subtract.
Oh, that's great.
And the same is true for breast surgery. You can, analyze everything with the TouchMD. When I come in the room, I'm trying to get to know the patient and so on. We do that. Our consults are up to 2 hours. They're not on a conveyor belt to the operating room where they're in and out the door in 20 minutes. And so we really take our time. And before I examine their breasts, if they want breast augmentation, we'll analyze everything on the screen. And I think that's a lot more comfortable for the patient, so that the exam is just a little measuring and breast exam, rather than saying, this nipple's higher. And, when you're looking them right in the face, I think that's really uncomfortable. So better to do it on the screen, and I think it objectifies it. Yeah, it works well.
Yeah, I agree. I also felt like it's more scientific if you're looking at images instead of...
Exactly. Yeah, and that plus you can draw perfect horizontal lines, and if one side's higher, one side's bigger, you can pick all that stuff up on the imaging.
Well, as a patient, looking down is not the same as looking at a photo.
Yeah, right. Good point.
And we have even ways of looking at ourselves that aren't always, like you look in the mirror in a way that makes your face look pretty. You never go, like...
Yeah.
So, yeah, I think that your point about it being objective is really valuable. Having been in the Twin Cities now for 38 years, do you start to see generational patients, like people coming back?
Sure. In fact, I have a whole folder on my phone with people's permission of mother-daughters.
Oh, wow.
That I've operated on. And then I can look at it once in a while and just feel really good about what I'm doing.
Yeah. So are most of your patients coming from other patients at this point?
I actually get a lot of patients from Real Self. I get a lot of patients from online, Google, the website, and then word of mouth.
Yep, the trifecta.
Yeah.
Is there anything on the technology or the science front that you're particularly excited about these days?
Yeah, I think there's a new device for breast implant delivery that's much more intuitive and less expensive that's coming out, because I was involved in Hot Topics, running the Hot Topics meeting for about 15 years. And there's fat injector processing all-in-one device coming out, I think, at the beginning of next year. 2024, maybe December 23, January 24,
Did Hot Topics already happen?
Yeah,
yesterday?
It happened Thursday afternoon, right?
Yeah, and those were the two highlights, those things?
Well, I'd say that's what's coming, yeah. And I wasn't at the whole meeting, but I have my own dissection course for rhinoplasty. That's a 4-hour course that I taught also Thursday afternoon with my faculty.
So What do you want patients to know about you before they come to see you?
Oh, and I get excited about helping people out. I mean, that's what gets me out of bed in the morning, is changing somebody's life. I mean, it's like there is no other job like that. It's just such a kick.
If someone is interested in coming to see you and is listening to the podcast today, where would you point them?
Just go online and check my website or look up Dr. Joe or if you spell GR in Minneapolis, you'll get my name will come up. So like Gurr, I guess. Not for great. Not for great, just for Gryskiewicz.
What's your website address?
It's tcplasticsurgery.com. So for Twin Cities.
Yep.
Yeah.
Well, thank you for sharing a little bit of yourself with us today. I really appreciate it, Dr.
Yeah,
Joe.
thanks, Eva. It was really fun.
Good to see you.
Good to see you again.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.